The time for drastic measures to protect Wisconsin's youth in crisis is now.
That is according to state leaders who shared new data today detailing the significant emotional challenges that teenagers are facing.
Dahil Moladin got a look at the state's latest youth risk behavior survey, the survey results, and joins us now with some of the biggest takeaways. Dahil?
That's right. Almost 20% of students surveyed had seriously considered attempting suicide in the past 12 months. That's the worst it's been since 2003. 1/3 of Wisconsin students also reported feeling sad or hopeless almost every day for more than 2 weeks in a row. That's a more than 5% increase in feelings of depression since 2019, making it an all-time high.
We've essentially erased some of the positive trends in decreasing suicidality that took place throughout the early 2000s. And what I mean by that is since 2011, our overall rates of suicidality have increased.
The data also showed higher rates across the board with depression, anxiety, and suicidality among females and kids who identified as lesbian, gay, or bisexual. While more than half of all students surveyed reported significant problems with anxiety, for LGB students, that number jumps to over 80%. This data was published just this morning from the state's Department of Instruction. High schoolers take the survey every 2 years across the state.
Well, despite the normalcy that is being built around mental health these days, these are some troubling trends. What do they attribute the reasons for this?
You know, that's part of the problem. They can't pinpoint just one thing. So, they'll say the pandemic played a role, but so did current political events and inflation. What they can say is what makes this worse is the lack of access to adequate care. That means a high demand for healthcare providers in schools, counselors not being available, so teens' needs aren't being met.
And with those resources being limited, the $6 million question that all parents and teachers are wondering is what can we do to help our teenagers that are struggling, because those statistics are sobering.
Yeah, so there is something that people can do, and it's actually quite simple, or at least the way the experts put it, is affirmation. That's what a lot of teens really need. They need to feel seen and they need to feel heard. So letting them know that they are supported and then following through with that.
Oh, that's good advice. That's something we can all do.
Yeah, absolutely.
Yeah.
Tahlil, thank you.
Tahlil, thank you.